At the last press briefing, we indicated that two things needed to be attended to if our country is to meaningfully deal with this challenge. The first thing we indicated that was absolutely necessary and urgent was to change the legal and institutional framework that the management of the pandemic is based on. To move away from the largely political institutions and actually partisan institutions to technical institutions and based on parliamentary anchor in terms of policy making and monitoring the implementation of the management of the pandemic. We indicated even then that this was not a new thing that we were proposing to this country. We have proposed this right from the beginning of the pandemic in March 2020. And it has been ignored, continues to be ignored. And the country will continue paying the price for ignoring to have appropriate institutions and legal framework. The second point was to use that legal and institutional framework to have a conversation and approval of a plan, a national plan, comprehensive plan for the management of the pandemic. Again, as we talk, you are aware that there is no known comprehensive plan for dealing with this situation. And one really gets a sense that there is probably a lack of full understanding of the gravity of the situation that we are dealing with. This is a very, very serious situation that is going to last for a long time. It's not going to go away. It's not something that you'll wish away, that you can bluff through. You know, this country is used to having situations that people bluff through, people suffer for some time and forget, and the situation continues. This is not one of such a situation. Now, without attending to these two, what continues in place is what we have been criticizing and what we believe is dangerous for the country. Because the reason government doesn't want to subject itself to a public process that is monitorable is so that they continue managing the pandemic in the same discriminatory way that they manage state affairs. Because state affairs here are managed in a very discriminatory way for the benefit of a few. And that's how they would like the pandemic to continue being managed too, you know? Actually, even when we talk about a lockdown, the people who are essentially locked down are the same people who are traditionally marginalized. They are the only ones locked down, the ordinary fellows. The privileged are not locked down. It's only those who move in matatus, those who move in buses, those who move on borders, those are the only ones locked down. Everybody else is essential. You go on the street and see. The other fellows are busy. The ministers are moving around, and as you know, there are very many. The MPs are moving around. The other people associated with the power are moving around. The big business men are moving around. Of course, their factories, as you know, are supposed to continue working. They even said tourists should come and tour. Those are okay. It is the ordinary person who faces the brunt of what these measures provide. More than 3 weeks after the lockdown, the most affected, which is the central business area here, not central business only, the central area here in the capital, not anyone has got social welfare support. Even after later on talking about 100,000 shillings for people to eat, nobody has received a cent here. And it's not yet clear when anybody will receive anything. I think the Lord Mayor maybe will talk a little more about his desperate people, the desperate people in his town, in his city. As you all know, that 100,000 shillings and the policy that they rolled out is ridiculous. Because, first of all, even after that long delay, when you talk about 100,000, you cannot understand how that will save anybody. For a family, our families have at least 4 people, you know? And there is claim to rely on UBOS, the Uganda Bureau of Statistics. They should see what the average family in Uganda is. In fact, I think UBOS puts it to about 6, the average family. So 100,000, what will it do? And for an unknown period. Already we are 24 days of the 42. 24 days already gone. Without anything. Nothing. You've closed people's survival who eat hand to mouth. 42 days. It's 24 days, not a cent. And you are talking about 100,000. The month ended, today is the 12th or 13th. The month ended 13 days ago. How do people remain in houses? Will they pay rent? Should they be thrown out? The landlords are on their necks. That 100,000 did not include the greatest majority of those who are needy, the ones who were never employed in the first place. Because most of the people who move into this city have no known work. They come to the city to see how they can get something to eat every day. No known work. They are not car washers. They are not involved in taxis. They are not bus attendants. There are many people who come to town come simply to do anything to get something to eat. Those are not catered for. The people who are totally unemployed. The ones they claim to have catered for are those who had some known income that has been cut off. But the greatest majority actually live with and from these hand-to-mouth people. You have disabled people that have not been catered for. You have the aged who are most vulnerable to be killed by this pandemic, not catered for, and so many other. But even those that are talked about, ghetto dwellers, maybe the Lord Mayor will tell us how long it will take to document ghetto dwellers and slum dwellers, and so that they can benefit. So, what these measures are doing is that they are on a daily basis weakening these marginalized people and exposing them to be killed by anything else, even if it's not COVID. Because it's not COVID that only kills people. Once somebody is very weak from hunger, malaria will knock that person down and will be in the grave the next day. Infections of the abdomen, diarrheal infections that would normally not cause a problem will kill people, and especially children. Diseases of children are killing children because they are hungry. Their ability to resist anything is very, very low. So the measures of lockdown in and of themselves are killing people, many people now. And we have a situation where there is really no attention to this. Without a plan, we don't know what will happen after 42 days. Because people are not being vaccinated, that you say after 42 days they are protected. So what would have changed after 42 days? It means clearly after 42 days, the only thing we should expect is an extension of the lockdown. Because if you unlock, you'll go back to where you were before you locked. Nothing has changed. Even the capacity to deal with the sick has not really changed. We have not recruited more doctors, more nurses, had suddenly many more beds. This has not changed. So end of lockdown will be start of a new wave of illnesses and death. So what it means now is that some kind of a lockdown will continue. People will continue becoming weaker and weaker, and therefore vulnerable to not just COVID, but to everything else. And we'll continue dying. Now, this is reckless for a country to continue along that path. Totally reckless. And like I said at the last briefing, it's incumbent upon us the people of Uganda to start taking these matters in our own good hands, to make our own policy and enforce it. And so I think the point here is that these marginalized people who are now desperate in their homes need to crystallize a plan of how they survive. And I think there are two things that we need to consider doing. The first one is to protect those who are vulnerable or most vulnerable. Everybody is possibly vulnerable, but protect the most vulnerable. And these are not very many. That has been, in a way, one of the saving factors in Africa, that the elderly are not many. The population in Uganda of those who are above 50 years is about 3.3 million. The population of those who are above 60 years is just 1.35 million. Those who are above 60 years. And this is a group that can be focused on to protect. So my appeal to everybody, to start with, is that let's do everything we can to protect, especially those who are above 60 and those who have chronic ailments that make them especially vulnerable. Those above 60 and those with chronic ailments, blood pressure, diabetes, heart problems, cancer, those who have those kinds of ailments, and the above 60. Let's take measures at every level to protect those people, because they are the ones dying now, most vulnerable to die, to become seriously sick and to die. And the immediate measure anybody can take is to isolate them. At the family level, isolate them to the extent that you can. At the community level, let's isolate them. If what we call our government can, that is an area that would be helpful to isolate those who are vulnerable, above 60, and the comorbidities, or those who have other morbidities, other illnesses. Isolate them only when they are not vaccinated, until they are vaccinated. So those who are already vaccinated, we don't need to worry about them. But those who are not yet vaccinated, and there are many, isolate them so that they become a priority for vaccination, so that they are known. let's use our communities to agitate that those should get vaccinated. In any case, let's not endanger them. Let's isolate ourselves from them to the extent that is possible. And I've been, talking to the city authorities, the local governments, can consider taking measures even at the local government level of how to isolate those vulnerable and vaccinated people. And then we appeal to international organizations to help us vaccinate those people. Because even what they are talking about importing vaccines, which we have already had over 1 million doses of vaccines, this should have been the priority group that should have been vaccinated. We would not be talking about worrying now. So let's vaccinate those first and foremost and protect them. Secondly, let's vaccinate the essential workers whose work make them more vulnerable, whose work require them to interact with many people that could be sick. And of course, that's where we have our healthcare workers. Our healthcare workers who are on the front line, their work requires them to be protected. Let's protect the teachers as a priority. And this appeal to whoever can help should target this. The Teachers Association should help to get all and agitate to get all teachers vaccinated. So once we protect these vulnerable groups, what is clear is that should end a lockdown. The rest of the people should be allowed to work. Go and fend for yourself with the usual soaps, mask, wash hands, go and work. Yes, some will become sick and get treated. But we will have a better chance of survival than when you lock down people without any support. As I have pointed out, we are now dealing with only the second wave. The third wave will even be stronger. This is just the second wave. There will be a fourth wave. So this thing is not going away tomorrow. And that's why we need concrete ideas of how to continue surviving, fighting through the pandemic. So that the first point that we are talking about, therefore, is an approach to getting our people back to work. That approach is protecting the vulnerable, letting the others out to work, including letting our children go back to school. Because first of all, the people they are closing out of school are not even eligible to vaccination. Vaccines are only for 18 years and above. So these kids are not going to be vaccinated anyway. Just vaccinate the teachers, put health control measures in the schools, to identify and isolate those who become unwell, examine them and manage them, and let education continue. The loss I have talked about, which we have lost of education, is colossal, is massive. But these fellows who don't care, their children are continuing. They have never sat. Their children have been promoted. Those who were in senior 3 are now in senior 4. Those who were in senior 2, they continue every day. They go to class. They don't care about the marginalized children. They are in the villages getting pregnant and other things happening to them. We must stop that. So vaccinate the teachers, let all the kids go back to school. Have measures to contain ailments at school. So this is the first response we think that is important. And a response that we really don't anymore consider that is a response to be implemented by, to the extent they can, yes, but the population must strive to work towards that, rather than waiting for the directives that will cause our people to get finished rather than save them. So that is the first thing. The second point that we would like to talk about is that this discriminatory approach, the ongoing discrimination and marginalization of the vast majority of our population must be tackled. This is an appropriate time to tackle that, to deal with it. And it's the people that must deal with it, especially those marginalized. The call is up to you to deal with this. Even when we talk about ending this quickly, it is to try and deal with the consequences to the marginalized. The reason these variants that are being talked about, part of the reason they are affecting even younger people more seriously is simply because even the younger people's immunity has been hit. By their nutritional status. Stress greatly undermines immunity. We've been talking about this. So if you have a whole community, a whole population under intense stress, malnutrited, with severe malnutrition that as is going on, and this is not affecting just the urban area, but even the rural, then it means that the ability really to thrive and survive and thrive is going to be progressively undermined. And so we really must deal decisively with the discriminatory policies and approach our country is managed by. And in order for that to happen, I would like to appeal to all people who are in that marginalization, in that category of people, the people who are really locked down, who normally will use a matatu, who will use a boda, who will use a bus to move around, those who are actually locked down. The only way the ones locking you down will pay any attention to you is for you to lock them down also. I think if there is no serious measures or attention to the measures to help our people, as we don't really clearly see these measures anywhere, let our people also impose their own lockdown so that all these members of parliament in there with their bipandes that for them they can go, all these government vehicles on the roads everywhere, the others are moving. Let's also lock them down. Then everybody will know that we live in the same country. Our stomachs need the same things. Wherever you are locked down, you also lock down whoever passes by your place. This can be done. Ugandans can also impose their lockdown. Then we can talk. Then there can be some dialogue about how we all survive. But if we are just going to be, folding our hands and say, what can we do? God will tell. God works through us, empowers us to take decisions, to manage situations. So I would invite us, if this situation of laissez-faire, of casual management, of a very, very serious situation continues, let's maybe give it up to the weekend. Also next week we lock them down. Yes, let's also put them on notice that either there is a dramatic situation or we are also going to lock everybody down. And we see what happens next. And people can, wherever they are. You don't need to move to any other place, no. Just lock down where you are. Whoever is passing, you also stop that one. And everybody stops every other person, and we see. Then we can have a dialogue. In other words, the only way we are going to get out of this discriminatory approach is by our own action also. We must protest what is going on. Thank you very much.